What is that? Oh, Hey y'all, I'm calling this meeting to order at 7:05. I'm gonna get roll call by Samaya.
Okay, Yawa, Amaya, Sanai, Tasha, Latasha. She's here. I don't know where she went. Jayla, Samuel, Ray, Alexander Ortiz, Nevaeh, Jessica, Zaire, Leanna, Hillary, Kayla, Maya, Fatima, Ahmed, Tamia, Derek, Maisha, Marcel, Micaiah, Grace, Kimberly, Daniel, Charlotte, Jalen, Sammy, Alex, Fox, Melody, Mason, Sarah, Hayden, Fernando, Janie, and Alyssa.
Thank you, Samaya. Can I get approval of the minutes? It was sent out by Samaya. Mason. Can I get a second? Can I get a motion to approve the agenda? Nevaeh. Can I get a second? Student forum. At this time, if there's any students present, you may speak. No students. There's no old business. New business. Our icebreaker, which will be led by Manny.
Okay, so for this icebreaker, when you go up to someone, reintroduce yourself, say what position, say your major, say your name. That way we can get accustomed to faces. Now, when we're doing this icebreaker, don't go to your friend. Don't turn left. Don't look at someone you already know. Meet someone new. I will stand over here and be on the mic. And if I see a friend group I already have seen before, I will say something through the mic. I will be watching. Anyways, so the way it goes is that you are gonna do it with your hand. So first you're gonna start off with saying something you are good at, like a good thumbs up, you know? You're gonna say something you're good at. Then with your pointer finger, you're gonna say a goal you want to point to or you want to get to, or somewhere you could travel as well. Now with your middle finger, I'm not holding that. You're doing a pet peeve or something you dislike. Now with your ring finger, it's something that brings you love or that you love. And then with your pinky, it can be a little fun fact that very little people know. No, there's no slide. Again, do this. Good job, good job. You're pointing at something, so a goal. Middle finger, I don't need to do anything. Ring finger is like you're getting married, something that brings you love. And then pinky's just random. That makes sense? Huh? No, middle. Yeah. Thank you. I'm gonna write these on the board, but y'all can get up and we're gonna spend like 5-ish minutes. 5 minutes. I gotta step out. Oh, my mom.
Oh. What was the thing you said? What do you say was the thing? And I forgot. This shit is not fun. What is it, Manny?
Thumbs up, something you're good at. Pointing finger, a goal or a place you want to visit. Pet peeve. Ring,
And that's
ring finger. It's literally called ring finger. Something you love. Pinky, small fun fact.
or
Somewhere you want to travel.
Oxford done.
Jai, did you put on a top? Did you put on that? 2 more minutes? Oh, let's do the icebreaker.
Me, you,
Yeah.
baby, I already know you.
You don't.
Okay, something I'm good at.
No, wait, that's not the. You gotta come
What?
Saturday.
What is it for me? What is it in for me?
Sammy, Sam, other than couples are gonna be initiated.
Oh, I thought they already were. Oh, hold on.
Hello?
Hey, y'all just came in.
She moved up in the ranking.
I would be. No, I mean, somebody made you one. Yeah. Everybody should be on here. So yeah. But
My pillow?
I'll come.
Hmm?
I'll come. Just, I'll be jump.
It's brave email. Huh?
No, it's so fun.
What do you want?
Fix something out.
You want us to put something that not. Also, apparently we got the stereotype of Mexicans and
I think I were Republicans at first. I literally, I'm like, every time, you know what James? I mean, I was like, you stop talking about my cat, and I was like, babe, why?
who?
Jalen, because I was like, I love my guy or something. No, the other Jalen.
Oh,
My old best cousin. But Jalen was like, can you start talking about that? They're like, why? And he's like, I don't want to talk about frat stuff. And I was like, girl, you just like you can't go to fight.
basic. Okay, you want to wrap it up now?
Well, yes. Or do you want to switch? Okay.
I don't know. People have their switching.
Okay. So you want to wrap it up?
Where's Jai?
Hold on, I'm gonna give her a second. And then ask if anybody wants to share. Okay. Okay.
You want to share?
Okay. Can everybody please take a seat now? Everybody return back to their seats, please. All right, hold on. Manny said that was no problem. You said that's your problem now. And then just forward it to that shit. Oh my God. Probably doesn't make us fast. Right.
Okay, y'all. I hope y'all enjoyed the icebreaker. I hope y'all met some new people. Okay, some good conversations, I hope. Okay, so now we have a speaker from the Student Health Services. So give them a round of applause, please.
That was a great one. I'm gonna borrow that. Can everyone hear me all right? Great. So definitely want to thank Jordan, thank Jaisha and President Awa, all these senators, student government. Thanks so much for allowing us the space to come and talk to you about some of the amazing services that we're offering over at Student Health. And so my name is Darren Aaron. I'm the director of the Student Health Service and the things that go on there. And I'm going to figure out that. So one of our goals definitely at Student Health is to kind of create a culture, right? Where all of the students at UNC Greensboro feel welcome and eligible to receive services. Where our providers are viewed as providers of choice for all students, for all of your health and well-being needs, an environment that serves 5-star customer service, that's welcoming, inclusive, and contributes obviously to your students' success and retention. That's definitely one of our goals there. And again, I want to emphasize that again, all UNCG students are eligible and welcome to receive services at Student Health for all the things we do there. Last semester, we met with President Haas a little bit, and we started introducing the idea of developing a student health advisory committee. And that's something that I hope to work with some of you, hopefully this year, to help develop that, get that started, a way that we can, I guess, have a group of students that we can get feedback from and share ideas, help us look at our website, help us look at some of our processes, and then also help us do a little marketing and kind of be our champions out there and to give us some real feedback so we can do the best that we can for all of our students here on campus. So I'm looking forward to doing that with this group here. So I brought with me some of my favorite people for student health that can talk about all the different services we have. And we're going to begin with our medical director, Dr. Tracy McMillian.
Hello. My name's Dr. Tracy McMillian. I'm the medical director at UNC Greensboro Student Health. I'm excited to be here. This is the first time I've addressed this group. Some of you all may have seen my name if you've been here more than 3+ years because of all the COVID thing. But I'm excited to be here. This is my 15th year. I'm starting here at UNCG. I've been the medical director for the last 4 years. So on this first slide, I'm not going to read all these services, but all of these services are available currently at Student Health Services. And the most unique thing about that is that they're all currently located in the same building. So you can get all of these, you have access to all of these services, going back to what Darren mentioned before, that all students on campus are welcome and eligible for these services, and you can get them all in one place. So, we realize that you all have a choice as to where you want to receive your health care, and we just want you all to consider us as an option. Because I'm biased, but I think we're a really good option. You can go to the next slide. So one of the other things that I'm very proud of within our primary medical care clinic is our provider staff. I have the opportunity to go and tour and visit other health centers on college campuses, and one thing that I like to kind of drive home, there's sometimes this perception that doctors and providers and healthcare clinics and on campuses aren't real doctors, or they can't work somewhere else. That's not the case with our folks. All of our providers are board certified in their specialties, and all of our providers have at least 10 years of clinical experience, and they all worked in the private sector before they came to work at College Health. So for me, and I can speak for myself personally, I made a conscious decision to come to work with this population because I felt like that was where I could have the most impact. And I feel like most of our providers feel the same way about that. We currently, as far as our medical clinic staff, we have 2 physicians, a nurse practitioner, and 3 physician assistants on staff. We also have a psychiatrist and a psychiatric nurse practitioner to provide some of the mental health prescription needs that our students may need. The other thing I'd like to mention, well, that little QR code will take you to our website, shs.uncg.edu, which is marked there. On the far right-hand side, you'll see AAHC Accreditation Association for Ambulatory Healthcare. And I'm also very proud of that. Our healthcare building has been accredited since 2004. And it's not something that you have to have. Not all medical or healthcare facilities are accredited. And what that means is that we have an independent group of individuals come in and make sure that we're adhering to certain levels of care, quality of care, infection control, making sure that we're providing nationally recognized, that we're meeting nationally recognized standards for provision of care. We are one of, I believe it's 8 schools in the state of North Carolina that have this certification. And it's a process that we have to go through every 3 years. So it's not something you get it and forget it. It's something that we have to maintain. And we're really committed to making sure that we provide the best care to anybody that we provide care to. So you go to the next slide. Okay, so if you all didn't know how to get a hold of us, you can always call, but I know that a lot of students would prefer to do things online, especially with the pandemic. People kind of shifted to doing things online. So you can schedule an appointment with us online, and it's available on our homepage to be able to go into the patient portal. All students have access to patient portal where you can schedule appointments, where you can get your, if you're seen there, you can get your walkout statements, which are your notes that you give professors that you can use for filing insurance, where you can submit your immunizations if, when you're enrolling as a new student. And there's also patient information in there about different health disorders and things to be able to refer back to. When you schedule your appointment, it would be based on your symptoms that you're having. If you get there and you're looking at the list, you're like, none of these apply, just pick up the phone and call us. We're more than happy to get you scheduled. We almost always have same-day appointment availability with our providers. So there's very rarely a time where you would have to wait. We prefer appointments, although if you did walk in, you would be assessed by a provider and provided an appointment if possible. You may have to wait a little bit for that appointment, depending on what our schedules look like, because they do get a little busier in the afternoon when students are getting out of their classes and things and trying to get some things taken care of from a healthcare standpoint. We also have an after hours line. So if you were to call now, that number you would get connected to a licensed nurse that if you're having cold symptoms or having a stomach pain or something like that, they follow nationally recognized guidelines and guidance to be able to tell you, is this something that can wait until tomorrow? Is this something that you need to go to an urgent care or emergency room today? And we get a report of that the next day. So if one of our staff need to reach out to you and just follow up and make sure that you don't need an appointment the next day, we can do that. So that's another thing that I really like, that you have access to healthcare advice if you need it after hours. You don't have to tough it out. You don't have to wait until the phones turn on at 8 o'clock or that sort of thing. One thing I did not mention was our hours of operation. So we're open from 8 to 5, Monday through Friday. And we're open from 12 to 3 on Saturday. On Saturday, it's really just kind of urgent care. There's only one provider there. So it's just kind of injury. We don't schedule appointments then. So it's kind of first come, first serve. And it's more of the acute care type of things. You can go to the next slide. And then this is my shameless plug that we are in cold and flu season. So I want to make sure that you're taking care of yourselves and making sure that you're eating well and sleeping well. But the best way to protect yourself, I'm sure you all have heard this ad nauseum for the last several years, is by getting a flu shot and or a COVID shot. We offer both of them at our facility. So you could always call and schedule an appointment in our immunization office to get either one of those or both if you decided to do so. Obviously you have to get the flu shot to provide protection against flu, and the COVID shot provides protection against that. Okay, next slide. Okay, so this slide just talks a little bit about the student health fee and what it covers. The big take-home point with the student health fee that all students that are enrolled here pay is that provides you access to us at no charge, meaning there's no copay to come see us. I know sometimes there's a lot of concern about how much when people are checking out, well, how much do you have to pay for the visit? If you come in and see me for an appointment, for an example, today I saw a student that had an allergic reaction to something, and all they needed was some Benadryl. And so they saw me, I spent a lot of time with them and did a full exam, and we talked probably 20 or 30 minutes. And they just got Benadryl on their way out. That was the only cost to them, was the box of Benadryl that they bought from the pharmacy, which Christian will talk to you a little bit about. There's no copay associated with that. So if you have to go to an urgent care, for example, I know my urgent care copay, I believe, is $75 to get in the door. If a student had a similar copay and went to an urgent care for a sore throat, they'd have to pay that $75 to get in the door. If they came to us and we did a strep test and a mono test, that's $47 at our clinic currently. And then, so there wouldn't be any additional cost other than the cost of the test. Costs accrue with us are for lab tests, x-rays. We gave you a splint or a brace, prescription medicines. And if we did any type of procedure, like if we sewed up a laceration or a cut, or if we drained an abscess, or I don't want to get too gross, kind of people were eating their dinner. And the other thing that I like to point out, which Christian will also reiterate, is charges are you have the advantage of billing things to your student account. You don't necessarily have to pay it on your way out the door. If you want to, you can. But that you always have that as an option for you as well. And I think that's all that I had, unless if anybody has any questions over this part, or if you want to wait for questions at the end, I don't know. Okay, well, I'm going to turn it over to Dr. Yeboah to talk about the pharmacy.
Hi, my name is Dr. Christian Yeboah, and I'm pharmacist on for the team. So Student Health Service Center is a clinic that, as you all know, you have your pharmacy, your medical doctors, your lab and x-ray department, and massage therapy, and another big section which Dr. Whitney will talk about. So I'll focus on the pharmacy. And I don't know, how many of you have been there before? Have you been to the Student Health Center? How about the pharmacy? Just using the pharmacy.
I tried.
You tried?
The pharmacy, I did.
Okay, good. So the pharmacy works like CVS, Walgreens, Rite Aid, or any other pharmacy that you know in town. our system of operation is the same as that. We accept most of the major insurances that you all have, and co-pays that you pay at the regular retail pharmacy will be the same as what you do over here too. The one advantage we have as compared to those in the cities is convenience, and also we understand you better than somebody you don't know at other places that you can go or you go to at home. You come to us, we can transfer all your prescriptions from your home pharmacy and then send them here for you to fill them at your convenience. When you're going back home or during vacation, we can transfer them back. So parents don't need to send you your medicines from home to school, and also all that inconveniences could be avoided. When you get your prescription, co-pays is the same as what your parents or you pay with the other local pharmacies. One advantage with us is you can put that on your student account. You can pay cash for it, or you can charge them on your debit card, or you can, if any of you have, I'll say other means of payment, you can use that. We don't accept so many things, but the regular ones, debit card, and I don't know if you do bank checks. The flex account. So those who have flex account, you can use them as well with us. And we also do prescription refills. You don't need to get prescription from the doctors at the services, at the student health service before you use. You can bring your prescription from home. Your doctor at home can call the prescription to us, so you can pick it up from us. So during that, you have your prescription with us, and all you can do is to call, hey, I have a prescription with you guys from my doctor from maybe from Durham. Can you fill it for me? Say, sure, we can go ahead and do that. So we will fill it, send you an email that your prescription is ready to be picked up. So all you do is to come in, get it, pick it up, and then pay for it. We provide medication counseling. This is medication education, but we term it medication counseling. We tell you how your medication works, what's the best time for you to take it. Some of these medications may cause drowsiness, and we understand you starting a new medication and you have a test or you have a class the next morning. So we instruct you as well that this may cause drowsiness. What are you doing tomorrow? Or what times are best for you to take medication that can cause drowsiness? If you can do that in the evening, we can determine, say, yeah, this can be taken in the evening. The best thing is this is once a day, meaning what, 24-hour cyclic cycle in your system. So if you're doing it in the evening, you stick to every evening and it's the same thing. If you're doing that in the morning, you stick to mornings and it's the same thing. But if you take one in the evening and then the next morning is only what, 12 hours apart. So that might cause problems. We tell you all that. We take time to take you through all that. If you compare this service to Walgreens or CVS or Walmart, what do you see over there? You're picking out a prescription? Yeah, here you go. You have a question? No. Okay, thank you. See you. That's all they do. But here you sit down. If you have any questions, bring all up, and then we're there for this. We're here for that services. So don't feel intimidated or think that we're in a hurry and we can't answer your questions. We can do that for you and with no other problems. We have over-the-counter medications, which is prescription that are, medications that are non-prescriptions. So meaning Tylenol, Advil, Aleve, ointments, creams, lip balms, blood pressure machines, cough mixtures, and creams, and bandages. We have all that, test kits, COVID test kits, and all those thermometers. All of those are over there at the Student Health Center. It's in a small section in the building, and if you can't find it, ask somebody at the front. Either you come to the pharmacy or at the front desk, you ask them, where can I find this? And then they will show you. If it's not on the shelf, we can order it for you the next day. And the reason why you should use us is we're cheap, because Tylenol is like $3 for 100 tablet. If you go to the other retail areas, it's more than that. You're talking about $6, $7, or $8. And thermometer is like $2. Blood pressure machine, $35. So these are all something that are really, really, really cheap. And when you get them from us, you can charge them on your student account and have your parents pay for it, or you can pay for that. You know? So I mean, you have all the benefits to use us, and you don't have to say, I don't have money to go buy this from them. You can charge them on your account and call someone to take care of that for you. But when you go to Walgreens or CVS, you have to pay before you leave the building.
And Christian,
So-
if I can add, one of the nice things that I think about the Student Health Center being on campus,
Mhm.
again, all of you are paying a student health fee, right? You've already paid that. And that fee, it's like this capitated payment that really helps offset a lot of those costs that are at student health. So that's how we're able to sell things at a reduced cost versus what you can get out there in the market.
Right. So just as Darren said, you already paid for some of these services, but you can come in and then use us and take advantage of what you already paid for. When you want to call for prescription refills and it's after hours, the number over there, the one with 3530, that's a voicemail line. You can call and leave a voicemail. Hey, I need this to be refilled, and it will give you a prompt as to what to do. So you don't need to mention your name, maybe your number, or your ID, or the prescription number. We'll take care of that and then send you an email the next morning. If you want to call and talk to somebody directly, the number on the left, the 3348 is a direct line, which you can call and ask all the questions you have. So I think you all should try us and see how we do business. And it's similar to what you do outside with CVS or Walgreens or Walmart. We do the same thing just like that. Your doctor can call us and give you a prescription to us, and then you come in and grab it. Next slide. And the next slide is another service that we offer on the campus. This is drug disposal box, or it's called prescription take back program. At first, traditionally, when prescription is expired at home, we say, what, flash it down or take it to the police station. This is what has been the norm in the past, but now we have one of these with us as Student Health Services. And there are so many benefits of using this thing because you're eliminating the drugs from the environment. Prescription or a drug like something we call doxycycline can stay in the environment for 100 years and it will never, never, never degrade. This goes down to, the running waters, to the rains, to the rivers, to the seas, to the fishes, and then it comes back to the ecosystem, and then we all consume that. So there are certain things that needs to be disposed of properly, and using this is the best way to do. This is something that was passed by Congress and approved and all those, and it's a service that you have to apply with DEA, which is Drug Enforcement Agency, apply with them and get permits to do that. And luckily we applied and we've got a permit to do that. If you Google UNCG drug disposal, this will pop up on their website, on DEA website, which is a federal website. So we approved to do that. And if you go in, grab all you want, either in a container or the plain tablet, open that little white thing, and then drop them in. Of course, needles cannot be disposed in there, and class 1 hard drugs like heroin and all those, it cannot be going there. But then all other things, right? All other tablets, be in the container, creams or whatever, remove them from your shelves and drop them in there, because people can solicit for drugs. Medications, let me use the word medications. Hey, you have Tylenol, can you give me one? Oh, I had this from the doctor, I still have 6 or 4 in it, can you take one? That might not be good. So if you're not using the drugs, if it's expired, if you don't need it and you want to dispose of these medications, send them to our place and then drop them in. No questions asked. You don't need to fill no paperwork or ask a question. It's in the front lobby. when you when you enter the building, it's on the left. So just open that and drop them in and go.
Thanks.
All right, any question?
I have a question about the pharmacy. So, I had called last year to see if y'all had my medication. And at that point in time, your pharmacy wasn't able to fill Schedule II controlled substances. Are y'all able to get to a place where you can fill those prescriptions?
That's a great question. We talked about that today, and we are closely, we're probably about a month or two into doing all that. We filed all the paperwork, signed everything out, got the permit to do that. And now we're working with our wholesalers so they can distribute or ship those medicines to us. Those are secure type of drug that need special approval, and we've got approval now. So those class 2 drugs can be filled on campus very soon, and you see that on our website when we start.
We've had a lot of feedback from students. I think they're on some stimulants and different things like that. We want to be able to provide that on campus.
Yes.
And as Christian said, it is a process where we've had to apply for and get certified for,
Yes.
prove we have the right policies in place, security in place. And our goal is to be able to begin that by spring semester.
Right.
Absolutely.
Yeah.
I was gonna say, do you guys have EpiPens and possibly Advil pumps? Because I know I use mine like at home. I was wondering if you guys would have.
We have several EpiPens. Yeah, different brands, whatever you want, we got it over there.
And what was your other, what pumps?
Do you guys have like asthma pumps?
Yes, we do. We have those too.
Okay.
Yeah.
Absolutely.
Mhm.
This is to whoever may concern, but insurance.
Yeah.
What insurance do y'all take? Cause I remember last year I had it was something wrong with my leg and I went to get it checked out and everything, but the reason they couldn't see me was my insurance. So what insurance do y'all take? Cause I know we do, several of us do submit our insurance, get the insurance
Sure.
waived.
Yes.
So, yeah, I was kind of confused by that.
Mhm.
Sure. So the easiest way I can answer that, and I'm talking about our medical clinic, right? So for our medical clinic, obviously, if you're on the student insurance program, the student health insurance program, Student Blue, we definitely take that.
Yeah.
Right now, we're only in network with some small groups right now. Cigna, MedCost. I think it's those two.
Mhm.
Our goal is to start going in network with other insurance companies. However, though, insurance really shouldn't be a barrier for anyone coming to us. Like Dr. McMillian said, we're going to see you. We can help you and look at you and examine you at no additional charge. Again, your student health fee has already paid that. If it comes to a point where the provider you're with says, you know what, we probably need to get an x-ray, or hey, we probably need to do some splinting or some sort of medication, or refer you to a specialist. Those are things where costs might get involved, but we're going to talk to you before that happens. There should not be a surprise to you. We definitely don't want someone coming to student health and being told, oh, I'm sorry, we're not in network with your insurance, so you can't be seen. And I'm
That
trying,
happened to me.
and I'm hearing that from a lot more students than I want to hear. And so I'm really working, we're all working with our staff to help students understand that, and our staff understand that.
Yeah.
Just because we're not in network, we will still see you, we will still take care of you. And we'll get you to a point at least where, okay, this is now going to involve things that it might be cheaper for us to refer you somewhere else. But many times, because of the offset of the student health fee, we're going to be able to do whatever for you, at least the initial stuff, for less money than you're going to pay out of pocket, even with your insurance. And when you leave your visit, we're going to provide you with documentation that you can submit to your insurance company for possible reimbursement.
Yeah.
Depending on your insurance. All that being said, it is a goal of ours also. And this takes a while. This is a longer process for us to get in network, especially with the larger insurance companies at first. Like the United Healthcare, the Aetna's, the Blue Cross Blue Shield, to get in network with those And then as we're able to do that, then start looking at, okay, what are the other groups that we need to ensure to support our students with?
Okay, so that was one of the ones. kind of-
Sorry that happened. I've heard other students say that, and we are really working with our staff to help them script that back.
Yeah,
And that's honestly where we need some help too with the student health advisor. How we can get that message out there. Is what I just said, that's hard to put in a
yeah.
tweet or.
Yeah, because it's it was a bit frustrating because I had to go all the way back home to get seen, and then it was like, I had to get x-rays and stuff done, and they did see something wrong with my leg, and that's why I couldn't
Sure.
walk properly. So I know that was like a huge concern for me of like why I wasn't able to get seen to see why I was in so much pain, so.
Yeah, and I want to move on with Dr. Whitney. Yeah, you know, on one hand, we want to be very transparent. We don't want you to be surprised.
Mm.
But on the other hand, we definitely can see and treat and help any of the UNCG students.
One other thing I'd just like to add from a provider standpoint, all of our providers are comfortable having this conversation. We're aware of the impact of cost on medical, on decisions that you all make in regards to your care. So we have those conversations every day with students. And if you don't and you have a question, ask us. Keep us honest to make sure that we're giving you the information you need to make the best decision for you. And I too am sorry that happened to you. We would have been more than happy because again, when you had to go home, that's time away and time you may or may not have had, and all the transportation back and forth. And if it was something we could have handled here through a discussion, then you could have started your treatment and all those things sooner and gotten to feeling better sooner. So that's our goal. And as providers, we're all committed to that. We realize that is the conversation that needs to be had. And like Darren said, we are talking and working on looking at the and accepting and getting a network with more insurance.
Okay.
Thanks, Ryan.
Yeah, and in addition to that, the pharmacy is almost like retail, separate entity from the clinic based on considering insurances. We take almost all insurances for the pharmacy, except for the government type of insurance like Medicaid and TRICARE that we're not in network yet, but we're working towards that. But all insurances, apart from that, you come in and we serve you on that. And even with those Medicaid and stuff, we can get you the cash prices, and most of them are really cheap that you can consider.
Thanks, Chris.
All right, thank you.
Oh, I want to check in. How are we doing on time? I don't know what your agenda looked like. I can talk for a long time, or I can talk quick. My grandpa always said, for a lady, I talk too quick. Till 8. Oh, okay. We're good. Okay, fabulous. All right, so let's switch our focus a little bit to mental health and well-being. Okay, so this is the other part of the student health services that Dr. McMillian referenced in that first slide, and we're going to expand on it a little bit, right? So how many of you have ever heard, with a show of hands, that college is the time of your life? Have you ever heard that expression? Yeah, where do you hear that? Where do you get that messaging? Everybody, you're from high school, your teachers, your grandparents, your movies, right? And so certainly there are so many things about college that make it a really wonderful time, right? Meeting new people, all the icebreaker activities. I've heard laughter, right? Being involved in student government. There's so many really cool, wonderful things. You can also read this list differently, right? It can create anxiety. It can create uncertainty. Will I make friends? Will I succeed academically? Am I going to make it into the nursing program, right? These sorts of things are also anxiety provoking. We can hold all of these things in our hands at one time, right? And the reality is, I hope for all of you that college is not the time of your life. I hope that things continue to get wonderful, right? But I also want this time to be a time that is one of growth and challenge and exploration, and that you're supported in all the ways that you need to be in order to be successful personally, professionally, academically, right? And so certainly your mental health and your well-being is a key component to that, right? So we know for our students that mental health concerns are real and they're actually growing. So this is a survey called the Healthy Mind Survey that we did back in 2022 here on campus. So we surveyed 10,000 students. We got a little bit more than 1,300 to respond, which is a great sample. It actually is representative. And so what you can see here is in the past 2 weeks, 45% of our students who responded to this said they met criteria for moderate or severe depression, right? So those are the symptoms within the Diagnostic and Statistic Manual. That's really concerning, right? Let's look at something else. Oops, no, I'm pushing the wrong thing. Anxiety, right? Same survey, same set of students, representative sample. Our students are struggling with moderate or severe anxiety, 36%, right? These are real impairments, and certainly they can affect your academics, student government, etc., right? All the ways that you want this to be the time of your life. Loneliness. This is the first time in 2022 that this survey looked at loneliness, right? One of the things we know from COVID, although it had existed pre-COVID, is that loneliness is a huge concern for our community at large, but specifically and pointedly for our college communities, right? And so again, you look at these numbers and we're seeing our students are really struggling with feeling connected, with feeling a sense of belonging, right? A lot of our students feel like they accept others, but they're not so sure if others accept them. And so these feelings of isolation and loneliness, again, really concerning. And of course, we know that all of this leads to academic impairment, right? You guys are all here because you want to get an education. You want to eventually graduate and get a job, right? Of course, you're here for other things too. We know that college is a time that is rich in so many different ways, but we know academics, right? And being successful academically and ending up with that good paying job at the end is why you are doing all of this work. And we know that anxiety, depression, loneliness can have a significant impact on that academic success. So when you heard Darren in the beginning talk about this 5-star customer service that is ultimately about your academic success, this is all connected, right? So we know, right? Okay, we talked about kind of like all right, Jen, turn it around. We know we're depressed, we're anxious, we're lonely. Come give me some good news, right? So let's talk about all the ways we are supporting you all holistically with regards to your mental health and your well-being. And if what you see, or not if, but what you see here rather is the 8 dimensions of wellness, right? Anybody name them? Give me some. Physical, financial, emotional, environmental, spiritual, spiritual, cultural. We link those together here. Professional or career, social. I know, I feel like I'm also, let's see, we've got love. Oh, why are you all here? I just said it. Intellectual, right? We're here, we're studying. Intellectual, right? All of those things are connected, right? One of the things I love about the wellness wheel is that it is represented in a wheel. How many of you guys have ever ridden a bike before? Anybody ridden a bike on a less than full tire, kind of a flat tire? All right. How was it? Not good. Not good. Why was it not good? Not enough air. It was hard to control. Did you get where you were going? It was going nowhere. Has anybody ever gotten somewhere on a kind of a flat tire? No, you just walked on that poor leg of pain, right? That's no good. That's no good, right? I've gotten places on a flat tire, but I, like you, have asthma. So at the end, I was flat on the ground, just having an asthma attack, right? You can do it, but it's super hard, right? And so that's what you're thinking about when you're thinking about your dimensions of wellness and how they're connected. And so you might spend a ton of time on social and then, your academics suffer, right? Or you might be like, yeah, I'm partying, but my bank account is suffering, right? Or shopping really makes my emotional health go up. What happened to my bank account, right? All these things are connected. So how do we support them? Well, certainly with regard to mental health, when we think about depression, anxiety, loneliness, all of the other ways that our mental health can be impacted, we've got counseling and psychological services, right? So counseling and psychological services offers you mental health support, right, in all of these different ways at no additional cost, right? So you heard Darren talk about the student health fee, you pay tuition. Let me tell you, I have no hair because I've pulled it all out from students who tell me I couldn't come to the counseling center because it costs too much. And I will say, oh, really? You can't afford free, right? Or a student will say, I can't come to the counseling center because you don't take my insurance. To which I say, you're right, we don't take any insurance. So that's not a problem, right? We really want to reduce the barriers for you getting what you need so that you can be successful in all the ways that you want to be successful, okay? The other thing that makes me pull out my hair, students say, I couldn't get in, to which I say, we have same-day services. Now, similar to what Dr. McMillian shared, the reality is we might only have 1 or 2 providers on same-day services. And if 5 students come in at that time, you might have to wait a little bit, right? But we're going to take care of you, okay? And if we aren't able to take care of you within our clinic, because we are an outpatient clinic, right? If you're needing a higher level of care, we have case management services. We're going to help you get connected to what you need to be connected with in order to be successful. We even right now have grants to help you get services off campus, because we know sometimes things like co-pays off campus can be a barrier to your treatment. We don't want that to happen. Just like Dr. McMillian talked about, we have a 24/7 number. It used to be on this slide. I don't know what happened to it. It's at the end though. We'll see it again. And that 24/7 number will connect you with a live therapist provider who will assess and treat and figure out what it is that you need. Okay. All right. Those are some in-person services. We also have a lot of really great online platforms. How many of you have your phone here? Hold it up. Show it to me. Yeah, we live online. That's just a reality. And the reality is it's not good or evil. It just is, but it can be used for good or evil. So I would say let's use it for good. I don't know if you're going to be able to snap on this QR code, but if you can, go ahead and do it now. This is Togetherall, right? We talked about loneliness. Togetherall is about connecting with your peers to get support. It is completely anonymous. What we find with Togetherall is that folks sometimes who might have anxiety, yeah. It won't work because that thing, yeah, that's what I was afraid of. I was afraid of that. But because it's not, thank you so much. I appreciate it. Because it's anonymous, we find that folks who maybe wouldn't step foot in the counseling center because of stigma, identity, you name it, right? They use this platform at a higher rate, which is super cool because we want to serve all students, right? Not just the students who, yeah, I can access care. I'll come into your clinic. Another online service that we offer. Oh, you might have to help me again. Now it died as far as clicking to the next place. There's a really great slide coming up that you're going to need your phones for again. Thanks, Awa. So this next platform is called WellTrack. So take out those phones again, because I know you want to use them for good and not evil. This is actually therapy in your pocket, right? So this is based on cognitive behavioral therapy. It's got stuff in there about anxiety and depression, which we already covered, top 2 concerns, right? It's also got stuff in there about loneliness. It's got stuff about there even about public speaking, because we know folks are more afraid of public speaking than they are of death. Not me, you can see, I'm more afraid of death. But, right, these sorts of things right in your pocket in between classes can help you to be successful in all the ways that you want to be. Oh. All right, we also have a really fabulous new program called Wellbeing Coaching. I like to think of it as like a guide on the side or an accountability partner, right? Anybody ever used like a personal trainer or gone to Kaplan and don't know? Oh, okay, yeah, right? Like having somebody, a partner who says, even if it's just a friend, to go with you to the library or do study groups, right? Having someone to hold you accountable for whatever your wellness goals are, really helpful. That's what Wellbeing Coaching does. All right, Project Connect. Again, talked about loneliness. This is for IRL connections, right? Really making, we know social connections online, they're not bad, but they're not all we need, right? We need in real life, personal, eye to eye, right? Soul to soul connections. And that's what Project Connect is about. Really great program. Not only do we want to support our own personal mental health and well-being, but we want to be a community that supports holistically, right? The mental health and well-being of all of us, right? You've probably heard before, hopefully you've heard this idea of culture of care. So one of the ways we create this culture is by ourselves becoming educated and trained in things like suicide prevention and mental health and well-being overall. So these are a couple of programs. The first two are suicide prevention specifically. Ask, Listen, Refer is all online. It's like 20 minutes, low barrier. Anybody can give 20 minutes to save a life, right? In-person training, then kind of the next step up is like an hour and a half. It's called QPR, or Question, Persuade, Refer. We are offering 3 more of those trainings this semester before the end of the semester. There's actually one tomorrow. And then last but not least, we do mental health first aid. And mental health first aid, the thing that's pretty cool about that, thank you, Dr. Craig, is that mental health first aid is really taking a holistic approach. We talk about suicide prevention, but we talk about mental health and we talk about substance abuse holistically, right? We're talking about depression and anxiety and eating disorders and psychosis so that you really can gain familiarity and decrease the anxiety that can come along with, because of the stigma, thinking and talking about mental health, okay? So I really encourage you to get involved in any of those programs. They're also part of the Spartan curriculum, right? So you can get extra co-curricular credit for participating in these programs. So think about it from that perspective as well. Wonderful resume builder. And then, like I said before, right, these are how you get connected with us. So that number that I was speaking about before is in the middle, certainly following us on social media. And of course, as Dr. McMillian spoke about before, we're located within Gove Student Health Center. All right, what time is it? Oh, it's 8:02. I was really thinking.
Thanks so much for having us here. My email address is up there. You're welcome to write that down. If there are any questions or any thoughts, comments you want to share with me, I can pass them on to other doctors that came here. Again, thanks for all you do. And I look forward to, I guess, continuing some conversations and putting together.
Thanks all.
We have a piece of legislation next. So we have SR 10101. Who's gonna read it? Ray's gonna present it.
Let's go. Hey, all right, so Spartans Against Spiking, Section 1. The Student Senate of UNC Greensboro Student Government Association adopts the following resolution. Whereas drink tampering or spiking refers to a drug or substance being put into someone's drink without their permission, this has been a relevant problem within various universities. Students have found their drink with a substance without their knowledge. This can lead to students feeling unsafe at social events. And whereas various reports have been found at our sister campuses, East Carolina University and the University of North Carolina at Chapel Hill, UNC recently had a report of assault following a drink tampering at a fraternity under the Clery Act Last year, various students at ECU reported drink tampering around Halloween weekend. And whereas the Student Government Association Current Concerns Committee worked with Pi Kappa Phi to create an informative drink tampering event, this provided over 70 plus students with drink cover lids and informational sheets on recognizing a tampered drink. This helped spread more information on drink tampering that is not common knowledge to a lot of students. Whereas students safely within social life is integral to our campus life, students are often handed a drink with no inclination of what substances may be in it. It is important for the Student Government Association to recognize our sister universities and provide resources for students. Spiking is an ongoing issue that continues to be relevant regardless of university, and now therefore be it enacted, resolved, the Student Government Association of the University of North Carolina at Greensboro calls for the Current Concern Committee to host an annual event with Greek Life to ensure drink tampering awareness. The Current Concern Committee will provide reusable drink covers for students with informational guides in order to advocate for safety within social events. Section 2, this act shall be effective upon enrollment. What?
Just to explain, why, Manny and I wrote the bill was basically because, we want it to be an annual thing where SGA participates with the fraternities on campus to have drink, cover lids. And we did it specifically during Halloween because that's the most time that people are going out there to social events. So we wanted to provide students, and maybe next year it can be a bigger event where they can be provided with more, but this year we had participated. So basically, this bill kind of says the Current Concerns Committee would do this event annually and host it with other fraternities, regardless of whether, it doesn't matter what fraternity it is, but host it with other campus life. Period, question and answer. So if you have any questions, please raise your hands.
No question? Okay. Can I get a motion to move into discussion? Can I get a second? Okay, we're now in a period of discussion. Mason?
I kind of does this one.
Yeah. I forget your last name. Mason, what's your last name? Oh, I was like, what's your last name? I was like, I forgot it. No? Okay. Can I get a motion? Remove. Okay, thank you. Huh? Oh, yeah. We're gonna table this to the next Senate meeting for a second reading. Y'all all wanna read. We have one more thing, Cards for Veterans. So Jordan gave me the idea of doing this. I know y'all tired, so we're only gonna take like 15-20 minutes. Is that okay with you? Yeah. But there's paper and markers up here. So
I don't want
you read the chat. No, yeah, I'm trying to respond. Huh?
I want to flip something.
Why?
I'm just
I was about to say something to you. Oh, I didn't know this was, hold on, let me go back to you. I'm guessing this is good.
I seen that.
Because I was like, I mean, he ain't gonna make a whole post. And that's not his girl. I said, okay. And that whole line did it. That's wrong.
Yeah.
You're gonna make your point.
Yeah, the guy. That's what I'm like.
There's no spell check.
Yeah, my God. I'm saying on brr, brr. This a letter to the veterans. Thank you for your service. Thank you for your service. Happy Veterans Day. Thank you for your service. I know. You say Happy Veterans Day. I couldn't find that's the only color they had in the box. That's the only color they got? Nah, they had other colors, but everybody else. But I said, listen, thank you for your service. And then what y'all put on this side? You set a great example. You know the veterans? I mean, yeah. They're not doing it for the country. They're doing it for their safety. You don't know what that PC is going to make them think. Wow. This is Veterans Day. What is Veterans Day? How was y'all Gino? It was same shit. I've never been to Gino.
Why didn't you go?
Yeah, I was at South Carolina. My dad, I'm trying to miss thing. You're not missing one.
Yeah, you can be smart.
That's really fun though. I
It's
saw
too
everybody
bad.
was outside. That's I do the best there. Yo, I'm talking to everybody, having a good ass. Yeah, it's cool. No, I ain't get no food like I wanted to.
Yeah, I didn't.
I don't really care about that.
But I didn't.
See, that's y'all fault though. Who goes to Jiho for food? Y'all are wild. No, y'all are tripping. I'm about to say, I had some shrimp from Dominion had some shrimp from East Side, so I had the shrimp. That shit was straight. Y'all are some sick people.
Yeah, so look at it.
They had some. It's in the bin. It's the purple one.
Get the purple card. I was about to say.
That's the only color that y'all have over there. That's the only color. That's the only color y'all have over there.
You gotta just point a little bit.
I said I did what I could. Is this gonna work on me?
I don't know. It's green. That's not.
No.
Yeah. I know, that's why I was like, if you have something you need to text, I think they're already. Yes. Not just even that too. I got
I just feel like I'm not in the position. So I gotta reapply. I feel like last semester. Well, I'm
next.
You want to be parliamentarian again?
I just feel like I'm only. I was able to do. I gotta do next fall.
Oh, you read the next one?
Yeah, so like I don't know what I'm gonna be able to do.
I mean, our parliamentarian last like 2 years ago. She did the same thing. She graduated in the fall. She still was parliamentarian. I don't know if you like being parliamentarian.
I was gonna say, is there anything like I don't know what
Take a break, Zaire.
like hey, no,
That's what I'm saying. You could just take a break,
how does that work?
and then like you just said, like right now you can't be active in your position. Like we would still hold it green.
Yeah, if you want to just take a break.
And if you want to be,
The last semester,
but you know, if you want to be a treasurer, do you still want to be treasurer next semester?
I was gonna say I don't. That's why.
You said you don't, you might, be thinking about that.
But it's in your senior year.
It is. That's
We
why.
got a few more months. Just hold it out. You get a little
I'll
more when you graduate. A little more when you graduate.
You might as well just keep going. But the thing is, though, I don't want to have it and then not do the position justice. Yes.
Is it just because you're busy?
Huh?
Is it because you're busy?
Yeah, I ain't expecting like the chapter president like being
Yeah.
so damn.
Man, don't get me started.
No, we're like there's so much that there's so much, bro. Like even just now, like there's an
That
event
is
right
stressful,
now.
yeah.
There's an event right now with the grad chapter. That
Oh, yeah,
exactly that. Like I
should
should
be-
you try to press like
Yeah.
I ain't know that. Yeah, bro. Like that's
I just
know the FSA means at the beginning of the year.
But like, you know, Grace.
If I be getting emails,
they
they be having back-to-back
Grace is also
emails.
busy too. Like as long as you let us know, we're gonna. I don't think it'll be a big deal as long as you like. But it's up to you. Like,
I just feel like I'm not doing the positions. Like I'm not popping out to events like I was
Yeah,
last
like-
semester. And it's like I feel like there's someone who wants to do that, and it's like I'm holding that position too. I'm just in the finance committee saying, everybody can leave. I just said Najee. I said when you move,
Yeah.
yeah, by December 15th. I said, "Ah,
Everybody take the go.
you can
Best
be
friends
the
are
oldest
cool.
member if we all leave. You can be the oldest member if we all leave.
Nah, my best friend is a guru. I just helped y'all the other night on Halloween night.
I know.
Exactly.
I'm
What
fine.
you mean?
I think I pissed off about that.
Why?
Because when all that shit, I walked past that nigga, do not speak.
What you?
He pissed me off, bro. Beyond that, good.
Not for you, not even try.
I still love you.
What you say?
Trailer, be so serious.
That nigga told me that. I don't know what else. None of that shit. None at all.
You cannot read this.
They not gonna know. All right. You can't read this. That's why I need to drop it. What?
Baby, gonna have to.
Tell that story. Girls are right. Like that.
It's made with love,
like a
though.
bud.
It's made with love. Hey,
Yeah, feel like a bud.
bro, you gonna cover it in. That's what
Yeah.
that's what her chick after though.
I'm like, you sure it's like a college
She did not speak
Right,
to me.
right.
I was like,
What's it? This second? Or the oh, that I see.
That shit was crazy.
You see?
Yeah, but see, I seen you out there. I said I see you out there because I know we took a selfie.
Yeah,
But I don't think I seen you. So I don't know if I seen you. That's
I'll probably go. There's too many people.
there.
I just remember seeing you. Should I say Sandra to make it more convincing? That way it's like Sam. We get it. We get a picture. I don't want them to. Like,
Love Sandra.
love Sandra.
Like, everybody.
Bro, I don't know if I have Chantel.
I heard somebody say something about a bitch. And I said,
Oh, but I ain't gonna lie. Oh, you talking about from wait. It's talking about that shit happened. Election killing.
Okay.
Oh, nah, damn. Sorry for that. He was not, that was not, that was not, we sorry.
Y'all got 2 minutes.
Cause I remember I was with 2 people from BSU and they thought the same thing. They were like, I was like, he's.
Or not.
I did.
Yeah, I'm not liking no message.
Yeah, nah, I was like, he's just.
Ain't like a kid. Yeah, I'm not.
Funny as hey, what is they coming up? How y'all feel? What y'all about to do?
We chilling.
About to have like a shake that money contest?
Yeah.
That's hard.
You wanna join?
Nah, not this year. Not this year, bro. I got you next year though. This is how we do it. I'll be there doing it. Yeah.
My God, like shit, but he's so good. He said that. You don't know.
That's your hard.
Y'all got 1 minute.
That's when it's been up.
Okay, y'all. Our 1 minute is up. Please wrap it up.
That was.
If y'all could please bring back the supplies, please.
No, that's Jalen. He ate. Y'all.
He
Nah, she was really doing it. What are you trying to do?
in that box.
Like, all of us get married one day.
Yeah. It's gonna be engraved. I'm like,
I appreciate that.
yeah. It's so cute.
So, yeah.
Yo, this nigga wrote fake names. I know how to A-walk. TJ taught me.
That shit look hard. I gotta pick
Y'all wanna see?
Yeah, somebody on yeah.
Hey, yo, wait, getting caught on camera like that is federal.
TJ my dog. Best game. I don't know. Yeah, but you do gotta do another thing. You probably do. She say a hoe.
No, that's not. That's.
DJ is fun. Huh? This nigga Abe said he in love.
I said he loyal.
Oh.
It
is.
The
The 1 minute is up. Please put back y'all stuff and get back in y'all seats, please. I'm ready to go home. He outside. Ain't it point of order?
Right. What water?
Point of order, y'all. Point of order. Point of order. Please. Point of order.
Hey y'all, so what I've been up to, so I went to the APRC Faculty Senate meeting about the mental health days. We got to talk with Amber and Mamadou and a few people about, what is the next steps on getting that on board on the academic calendar and just meeting with various people. And then we have a meeting with Alpha for the business drive. So me and Jordan and some members from Alpha are trying to make a business drive to get more business referral. Jiho, that was really fun. I had a meeting with Amber and Mamadou about the mental health initiatives, and we're having one again this week. planning International Friendsgiving with Dr. Craig and Jaisha and council. I had a meeting with Dr. Akins, and then preparing to leave my congressional era. I worked within Congressman Manning's office, and I'm leaving because I have a new job now. But yeah, it's so sad. I've been working there for 2 years. So I'm starting my new job as a family law legal assistant. So I'll be handling casework within that. And then I have an exec council meeting this week, collab with Alpha. So that should be this upcoming week. And then we have ASG coming soon. And then we have the Friendsgiving, which is the 20th. And then I have the faculty mental health day survey. So we're going to go around and see more people and see their like perspective. And then Thanksgiving and finals. And then this is me because I'm ready for Thanksgiving, child. But yeah. Oops, I don't know why it went like that. Okay, where's Manny at? Oh,
Yay. Hello. There we go. So what I've been up to, I helped out with the SOS group interviews this past week that happened. Class registration, I kind of missed it, but it's fine because I'm taking senior level classes only senior can take, so I wasn't stressed. I went to the financial symposium with Mason. Where's Mason? Oh, there you are. Down to Charlotte. That was kind of fun. Took a train down there, got delayed by 3 hours, fun and fresh. Then I did a Buenvenido student panel, and that was pretty fun. Yes, there it is. What's it called? A little history. Actually, no, a little fun fact about the top left photo. They set my mom up. So they invited her over here just to like see the vibes, you know, invited a parent, my mom, because I know the person, Margarita, shout out to her. But then Margarita set her up and was like, actually, do you want to be on a parent panel? And she was like, yeah, sure. And she said she didn't talk much or else she would cry. So shout out to mom. But then I went to Joji's concert that same day. That was really fun. He started playing Smash, if you know about that. And then I did the SGA blood drive this morning. And yeah, and that's my dog and my cat. Okay, so what I have coming up. So I have the Financial Wednesday. If you know the Student Health Center, they are doing a drop-in session for financial literacy tomorrow between 10 and 2 in Azalea. No. Yeah, Azalea. And then I have a case hearing tomorrow for OSRR. I'm having PAL Professional Development, the last one, tomorrow as well. And then next week is going to follow with individual SOS interviews. Then Storm the Streets is Friday. Woo! We're playing A&T. Woo! Get ready to storm these streets. Anyways, and then initiation day for our new members of Pi Kappa Phi. So that's going to be pretty fun for Sam and Sammy on Saturday. And then here are my photos. AI generated photos are starting to become my favorite thing. Anyways.
It's me again. What I've been up to one-on-ones with senators. I had a meeting with Dr. Craig, and then I had a meeting with Dr. Akins today. Planning the International Thanksgiving with Alwa Manny and Dr. Craig and Meredith. I did some Narcan training. If y'all don't know, a mobile health scholar for the nursing school. So we did some training about that because Guilford County has an overload of cases of opioid overdoses. So I mean, if y'all need help, y'all just call me. I come help. I had class registration, and then these some pictures of me at the tailgate at A&T. That's me and Abe, and then that's me, my profile, my deuce, and one of the noobs. Jason. Okay, what's coming up? One-on-ones, more one-on-ones with y'all. The eat and greet Kaylin is having tomorrow at the CAV. I have a meeting with Tasha and one of the grad assistants from OIE about Native American History Month. I don't know where I got national from. I'm gonna have a meeting with Provost Stores sometime. I just emailed her today, so we got to get that figured out. Sunday is my first Founders Day, and then next Wednesday is my first Charter Day. So shout out to all my sorors in the room. Tamaya's 21st birthday is on Friday, y'all. So wish her a happy early birthday. And then I'm ready for Thanksgiving break and ready to take my finals so I can go home because nursing school is hard.
Yeah, not yet.
I know. And then, yeah, make some noise, y'all, and this is a picture of Samaya sleep on my, she was asleep on the counter, y'all. So I just had to take a picture of her, because I'm tired and I'm ready to go home. Okay, Senator Forum, at this time, any member of SG, well, not any member, any senator can talk for 2 minutes. Yeah, in a minute. Melody.
Okay, everyone, okay, so, I'm having well, me and Foster are having our first scheduling event, our first event as transfer student seminary. So if you know anybody who's a transfer student, and likes pizza, and the things provided, please come out and support us, and that'd be great.
On the 10th at 11 a.m.
At 11 a.m., you will see.
Period. Do y'all need help? Like, did y'all make a sign up sheet?
Yeah, so see like we don't like help, like pass out the people, like, do you need help?
Yeah, do you need help?
We'll make a sign of being smile, and I'll put that in the chat, or I guess email us the better way of communicating, which everybody gets, so yes.
Okay.
Support if you can.
Period. Fox.
November 19th, we will have our first fencing tournament here on campus. I don't know how long. So, I mean, yeah, it's been years because of the pandemic and that kind of thing. So it's gonna be here in Catholic, open to all students. If someone is not a student and wants to come, they just need to donate some food or pay like what, $2? Yeah. I think we're opening the doors at 10. The fencing tournament starts at 11. This is my first tournament in any sport ever I've signed up for, to come cheer for. There's a lot of students who've been training all semester in an Olympic sport that, you know, maybe years from now, at least one of us, maybe not me, will make it to the Olympics, you know, but like, I'm seeing people fight the swords. It's all. So November 19th.
Okay. Good luck, Fox. I'm gonna keep it on. Okay. Any member of SGA can speak up for 2 minutes. Mama do.
All right, so tomorrow we have my first table 2 minutes in the UC. Okay. It's gonna be at 3:30. Reaffirm yourself. You're gonna have some time to do some stop by.
Tamia.
I guess it says it really monotonous, but I kind of just wanted to say thank you to everyone who signed up and volunteered at the blood drive. Alyssa, I know you stayed later and you didn't have to, and I wanted to shout you out for that because I appreciate you a lot for that. Anyone left, but she also stayed later, I know, and anyone else who stayed later, I very much appreciate you. Couldn't have done it without you, and furthermore, if you can't attend, if you can't, something hands up, you can change your sign up, let people know. It's not the end of the world if you can't come, we'll figure something out. So just wanted to say that.
Okay.
This year related, my exams are coming up, so I just hope everybody can, you know, just stay focused and study and do what they need to do. So, yeah, good luck.
I'm gonna get Awa and then Hunter. Somebody's gotta give their time, I think. Do they?
No.
Okay, good.
But I just want to give a shout out to Tamia. She got this position last week and she ran the blood drive. Like she did her thing. Like that, you didn't really need to.
Hunter. Hunter Hayden. Dang, y'all, it's been a long night. Because there's a Hunter in here. No, because there's another one. Yeah.
Tomorrow at 7:30 in Chu Recital Hall, School of Music, there's a horn choir concert that I'm playing in, free, open to the public. So if you're looking for something fun to do, just come check it out. It's gonna be a lot of great music and hopefully a good time.
Okay, that's it. I ain't gonna end it. Well, I'm gonna end it, but. Okay, y'all. I know it say adjournment roll call, but it's not being ended yet. Dr. Craig is gonna come speak, but we're turning the Zoom off.